As part of Rebound Maryland, we're working to make sure you are able to manage the pressure during these trying times. That's why I spoke with Dr. Rashna Razinghani to discuss mental health and your overall well-being during quarantine. I guess one of the things that I feel like it's affecting everybody is kind of like that cabin fever mentality. So I was wondering how people can kind of get through that in a healthy way.
I think the best thing for that would be to figure out what is allowed and what people can do rather than focusing on what they cannot do. So, for example, if you're able to go out for a long walk in your neighborhood, if there are woods next to you where you can maybe go for a solitary hike or maybe with a couple of your family members, that would get us out of the house and do some things. And we are still able to go out, do some grocery shopping, etc. So I would take advantage of that outing and maybe take a couple of extra minutes to just sit there, take in the outdoors, and then come back in and be ready for the next round of staying at home indoors cooped up.
It's probably difficult for some people to kind of break, like if they're already stuck in these routines now of, oh, I wake up, I go and sit at my desk and work for a couple hours, I go and walk my dog, to how they can transition out of quarantine positively while
Mhm.
breaking those routines.
The answer would be bit by bit. So, for people that live with other family members, I would kind of set up your own little incident command team or command center at home and make a list of all the things for which people go outdoors, like, say, for shopping, eating out, um, to the gym, movies, those kind of things. And again, set an order of priority. What is the most important thing for someone for their quality of life, and start introducing activities little by little rather than doing a complete 180 and going from being cooped up all the time to now you know breaking bad, so to say, and just doing everything that you were not allowed to do during the
Everything all at
lockdown.
once.
Yeah. So gradually would be the answer, and in order of priority. And I would also recommend calling establishments and finding out what their schedules are, whether they are doing things by appointment, rather than taking walk-ins, and just being aware of those things, uh, to to be more mindful of our surroundings and how one can safely reintroduce ourselves back into our routines.
In terms of like mental health resources, um, what can what kind of resources are still out there? Um,
Right. So I think, when the shutdown first started and when we were getting in the middle of the pandemic, when we were just getting started up, it took a little bit of time for several medical practices and hospitals to figure out, well, what can we still do to continue to serve our patient population during this time. As more and more time has elapsed, I think a lot of practices have now started offering appointments virtually. And as a result of that, many patients with psychiatric issues may hopefully still have access to their psychiatrists, psychotherapists, nurse practitioners, etc., through virtual technology. Unfortunately, psychiatry is one of those fields where not a whole lot is missed by doing a virtual appointment compared to, say, some of the other procedure-based specialties. So I would encourage patients to reach out to their doctor's offices and try and find out whether they're still open and whether they're doing this virtually. And simultaneously, a lot of platforms have also stepped up to the task, and they are offering easy ways of doing video visits. And I think that's been really helpful. So those are some of the things that can help. And then in general, there is, for patients, making sure they have enough medications, asking either their psychiatrist's office, or if they're unable to do so, then their primary care doctors to give them refills of their medication so they're not running out and then having discontinuation symptoms, etc. Those would be helpful things. I think one point I wanted to make was, a lot of things are happening virtually. So you and I are talking over Zoom, and a lot of meetings, a lot of communication is taking place virtually, and we don't realize the importance of nonverbal communication, and a lot of the messaging gets lost in the process. So I would just encourage people to try and utilize their words to convey their feelings more so than they usually would, to make up for their this lack of or inability to be in the presence of someone when communicating. And as always, I would say stay healthy and stay safe. Do the best you can for yourself before you can help anyone.
And remember, if you're struggling during this pandemic, we've got you covered. Whether it's making ends meet, finding a new job, building a resume, or just managing the pressure in general, we've got all of those resources for you at wmar2news.com/reboundmaryland.